Hi, this is Dr. Kevin Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today we want to talk about something called Stevens-Johnson syndrome, and we're also known as Erythema Multiforme major. And while we're at it, we're going to help to distinguish this from its innocuous cousin, Erythema Multiforme minor. Please remember that these video series do not replace visits with your physician. If you're concerned that your child has either of these diseases, please make an appointment to be seen. We can see you in our office same day, area code 775-359-7111. This is not the kind of thing that should be handled over the internet or over the telephone. You need to be seen in person. So, what is Stevens-Johnson syndrome, and for that matter, Erythema Multiforme minor, and how do you treat it, and how do you get it? Nobody really understands the exact mechanism for these diseases. They just come on. Certain things seem to be involved in causing them. And the causes are similar for both disorders. So, in reality, the majority of the time, we never find the cause. So the most common cause is what we in medicine call idiopathic, meaning we don't have a clue. Certain viruses can be involved, including herpes virus, and that causes lots of diseases, not just cold sores. Something called mycoplasma is a big offender for this, and mycoplasma causes lots of walking pneumonia, low-grade fevers, cough, and not much else, but can cause both Stevens-Johnson syndrome and Erythema Multiforme minor. Certain drugs commonly cause this, and the list of drugs is huge. We're not going to get into all of the drugs, but the common ones in this country would be any of the anti-seizure drugs, in particular phenobarbital, Depakote, sometimes called valproic acid, Tegretol. If you're on those drugs and you think you have this disease, stop the drugs, call your doctor right away. Okay, we use those drugs for seizures, we use those drugs for bipolar affective disorder or manic depressive disorder. So if you're on those drugs and you think you have Stevens-Johnson syndrome, we want you to stop. These days, with the rise of a common infection called Community-Acquired Methicillin-Resistant Staph aureus, probably the biggest offender is a drug called Bactrim, sometimes known as Septra, sometimes known as sulfamethoxazole trimethoprim. And in particular, it's the sulfamethoxazole component that causes this. And in recent years, that's probably been 80% of my cases of Stevens-Johnson syndrome, as well as EM minor. So how do we make the diagnosis? In both cases, there is no test. So this is another one of these, you walk in and you recognize it for what it is. Erythema multiforme minor is just that. It is a minor disease. Patients are not ill with it. They're running around, they're playing, they're happy, they're normal people, they just have blotchy rash. A lot of times people think it's just hives. When we look at it, we can tell what it is. The rash often involves the hands and feet, as well as the extremities and the trunk and the face. But there's no other changes. The patient's not having a fever, patient is not ill appearing, patient is eating, drinking, and otherwise feeling good. They just look funny. Erythema multiforme is benign, it is self-limited. We take you off the offending drug, if there is an offending drug. If there is no offending drug, then we chalk it up either to a viral infection, mycoplasma. If you have mycoplasma, we treat the mycoplasma, and we let it go away on its own. The rash will disappear in a week or two. Erythema multiforme major, or Stevens-Johnson syndrome, however, is a major disease. It makes you very ill very quickly. So you get the same rash. Again, it's splotchy red rash that's bumpy, often with pale centers. These things look like targets. They're often confused for hives. There are some distinguishing features that are a little difficult to describe. When we see them, we know what they are. But what distinguishes this from the minor is that it involves the mucous membranes as well. So the eyes will be red, the lips will be blistered and or cracked, sores in the mouth. Patients oftentimes will have difficulty breathing because these sores in the mouth extend all the way down the trachea, the windpipe, and into the lungs. They'll often have blood in their urine. They'll pee blood because these same sores are lining their bladder and the inside of their kidneys. And they'll often pass blood per rectum, so poop blood, because these same sores go down their esophagus all the way to the other end. Stevens-Johnson syndrome often results in sloughing of large amounts of skin, and these patients wind up needing to be treated in burn units when that happens, because they become essentially a burn patient with burns coming from the inside out, sometimes is the way people describe it. Exactly why this happens from exposure to Bactrim, or why this happens from exposure to Mycoplasma, nobody understands it. It just happens. But the patients get very sick very quickly. This is an absolute medical emergency. If you think this is happening, you need to go to the emergency room now. Or call 911. Your child really needs to be initially managed in an intensive care unit, even if they look stable, because of the risk that this disease is going to progress. Once we've stabilized your patient, they can go from the pediatric intensive care unit to the floor. But in the meantime, the pediatric floor is not a place for your child unless you happen to be in a large children's hospital. So if you're in a huge children's hospital like Children's Hospital of Los Angeles, Children's Hospital of Oakland, Children's Hospital of Orange County, it might be appropriate to be on the floor because they've got a giant ICU ready and waiting for you if you need it. But you should not be in a general pediatric ward in a hospital that doesn't have a giant pediatric ICU to move you into quickly should you need it. That would be a bad place to be. So to be in a small community hospital with no peds ICU, don't let them do that. You need to be transferred to an ICU and start there. Beyond that, what helps is very controversial, and there's papers all over the place. People have looked at high-dose steroids, and for years it was thought that helped. Then later there's some evidence that maybe that increases your risk of infection. People often fall back to doing nothing and letting the disease take its course. That seems to work almost as well as anything. There is some evidence that high doses of a drug called intravenous immune globulin can help to limit this disease, and my limited experience with high-dose IVIG in Stevens-Johnson syndrome is that it has worked well. However, we're often limited in our ability to get the high doses in, because when we give a dose of IVIG, the child's electrolytes, the salt in their blood, drops, and it can drop into dangerously low levels. And it'll often do that before we reach the high dose, while we're still giving low-dose IVIG, and low-dose IVIG doesn't seem to do much. Sometimes we can't get the sodiums up high enough to be able to give the high-dose IVIG, and that seems to be a major limiting factor in our ability to give this medication. The medication is also very expensive and only available in larger facilities, so smaller hospitals won't even have it. So that can also be an issue. If you're in a small rural town or an outlying area, your child needs to be transferred into the large city. Don't let them try to keep you in a small hospital in, say, Winnemucca, Nevada. You need to be in a facility no smaller than our largest facility here in Reno. And that's, depending on how severe your child is pushing things. You may wind up needing to be in a burn unit, and there's less than 100 burn centers in the country. I'm hoping you're watching this video because your child has Erythema Multiforme minor. Well, before we get into that, oftentimes the children can't eat. Oftentimes they have difficulty breathing. We have to keep close watch on them for potential respiratory failure, which is another reason we like to keep them near an ICU, because if they go into respiratory failure, it happens fast. This disease is a bad actor. It's very scary, both for me as a physician and certainly for the parents and for the children who have it. The disease can leave you blind from scars across the corneas. It can obstruct your bladder to the point where you get urinary outlet obstruction, and various surgeries need to be done to alleviate that. The children can perforate their intestines as a result of that and develop horrific infections. They can develop horrific skin infections. So this is a scary disease. I'm certainly hoping you're watching this video because your child has EM minor, or because the name sounded cool, or because you know somebody named Steve Johnson and thought that might be cool. And not because your child has Stevens-Johnson's disease. If we can be of assistance, give us a call at area code 775-359-7111. Please don't email me. This is one I will not email you back on because I don't want your time wasted waiting for a response. If you are concerned your child has this disorder, they need to be seen now in an emergency room. Do not wait. Don't wait for me to email you back. Don't wait for me to call you back. Don't wait for anybody to call you back. Go to the hospital now. Hopefully that's not going on for you. We'll see you next time.